So we're going to go over the major structures of the heart. Before we do that, what are we looking at? If we were to look at a real heart, the outer layer would be the epicardium, which is endothelial cells. We would see the endocardium lining the heart, which is also endothelial. But the heart muscle itself is going to be the myocardium, the thicker muscle part. Now, what are some major structures we can see? We can see the chambers: left ventricle, right ventricle, left atria, right atria. Right? And this major structure is the pulmonary trunk. This is the aortic trunk. You can see the superior vena cava. The inferior vena cava would be over here. These two veins are the pulmonary veins, and these are the pulmonary arteries. Now, if we were to look at a real heart, there would be fat covering these vessels on many hearts, but we can see right away these vessels down along this structure we call the interventricular septum, or the wall between the two ventricles. All right, let's start off with the atria. We can see that they have these little overhanging appendages. We call the little overhanging part the auricle. Now, looking into the right atrium, we can see some of these stringy muscles here. We call these the pectinate muscles. We see immediately that there's this blue structure here. There's a blue structure coming from the inferior vena cava. This one is from the superior vena cava. There's another structure here coming in from the coronary sinuses. This is all how blood enters the right ventricle from the systemic circulation. This right here would be the fossa ovalis, which is a remnant of development. Also, similar to fossa ovalis, we'd see the ligamentum arteriosum. Now, the way that blood gets from the right atrium to the right ventricle is through the right atrioventricular valve, or we're going to call that the tricuspid valve. Tricuspid because it has three valve leaflets. Right, you can see one here. It also has three sets of papillary muscles, 1, 2, 3. 3 sets of chordae tendineae, which are these tendiny strings. Right, and you need papillary muscles to keep blood from flowing back from the ventricle into the atria when the ventricles contract and only going in one direction. So the right ventricle pushes blood into the pulmonary trunk, and it's the semilunar valve here that keeps blood going in one direction. So when the ventricle contracts, eventually it develops enough pressure to open the pulmonary semilunar valves to open blood into there and to go into the lungs. Right? We notice that the muscle layers here form ridges. This is referred to as the trabeculae carnae. Now, moving over to the left side of the heart, which in our model is all one piece, we can see the left atria, the left ventricle. This valve has 2 leaflets. It's called the bicuspid, or most normally it's referred to as the mitral valve. It can also be referred to as the left atrioventricular valve. So here's one leaflet. See that there's a papillary muscle that should be associated with it. There's another one here, and chordae tendineae. And this valve, it's hard to see because it's right back here. It's not going to show up in the video, but that's going to be the aortic semilunar valve, which is how the left ventricle empties blood into the aortic trunk and eventually into the aortic arch. Right, we still see trabeculae carnae, we still see pectinate muscles in the atria, and we can also see that there are veins entering into the left atria. Usually we draw veins blue, but since the pulmonary trunk pumps blood into the lungs, the blood coming back into the left atria is now oxygenated, so we draw that red. So what are the blood vessels that supply the heart? These are very important. We can see the right coronary artery coming off of the aortic trunk right here. We can't see the left branch, but we can see where it comes out behind the pulmonary trunk to form the left anterior descending coronary artery, or as in our lab manuals, we call it the anterior interventricular artery. That's this major branch here. We have the circumflex artery here. We named this branch of the right coronary artery the marginal artery, and to show you the posterior interventricular artery, which, like the anterior interventricular artery, is along the septum. I have to take the model off the stand and flip it over, right? So you can see this is the posterior of the heart. So here's the posterior interventricular artery right near the inferior vena cava, and you can also see the coronary sinus, right? And you notice that the trachea and esophagus are right up against the major vessels of the heart, and that is the heart.